Hey everyone, Julie Heath here. This video is going to go over OMS. So what is OMS and why do we need it? OMS is a simulation app that's called Oxford Medical Simulations. And basically the reason why we need it is because it is helpful in a virtual environment. This is where you will use your VR goggles and use it to simulate an environment that will interact with a patient, with a virtual patient. They're a little cartoony, but it can be a lot of fun and interesting things happen in those scenarios. You will find out. You're going to have a lot of different patients. A lot of time you'll have George, or you'll have who else? Tina as your patient, and you'll get to know the patient. You'll get to know kind of, what is going on with the patient. You have an assistant that kind of introduces you to the scenario and tells you what's going on with the patient prior to interacting with the patient. And then you'll go through and you'll ask the patient a lot of different questions and kind of do an assessment on your patient. So it's actually very helpful in different ways and can be very stressful as well. So hang in there. We all feel your pain. And if you have any questions or concerns or are not getting it or are very frustrated with the scenario, please reach out. Your learner ambassadors are here to help you. We are learners as well. We are going through it with you. So, and a lot of us have done these before and have the same headaches and know how to get around it or know how to go through it. So please feel free to reach out. We are here to be on your team. So let's get started and we will get through this together. All right, y'all. So welcome to your tutorial on OMS. So I'm going to go through and kind of introduce you to the field. And while I am doing it, I will give you my personal tips and tricks that I've learned along the way to hopefully help you get familiar. So here we go. I'm going to go ahead and share my screen. As you can see, I am in the dashboard in Canvas. So first things first, you want to click on your BSN main course. So like, for example, you will not have OMS assignments in other courses necessarily. So you will probably only have OMS assignments in your main BSN course, whichever one gets you to the next level. So this one I'm in 346. So I'm going to go ahead and click on that. I do have, it's not week 5 yet, it's week 4, but I do know that there is an OMS assignment in week 5. And so it's the VR tutorial, which is perfect. So I'm going to go over that. So OMS virtual tutorial. This is great for you to do pretty much anytime you really want to do it. If you want to get familiar with it, if you want to kind of look around in there, that's great as well. Okay, so there are 2 different ways that you can do this. Sometimes they will allow you to have computer access, depending on the situation. If you have a medical condition or something that prevents you from using the VR goggles. But so I have both here. So I'm going to show you first the VR goggles. I'm not going to go over how to set those up. There is a tutorial on that. Keep an eye out for that. But this is how you would log in. So I'm going to go ahead and click on VR headset. And it will give you a code, okay? Then you're going to go ahead and take that code, BLZKH, and you're going to go to your VR goggles and you're going to click on the BLZKH or whatever, whatever code it gives you. That's how you will log into your OMS on your headset, okay? So that's how you get into the scenario from the VR goggles. So I'm going to go back. If you have a computer access, you would just click on the on screen. It'll take you through the warning signs. You just click on launch OMS. It's loading as of right now, and then it will load the scenario. Hopefully. Sometimes it takes a minute.
Hi there,
Okay.
and welcome to orientation. My name's Natalie. I'm a nursing assistant here in the emergency department, and I'll be your guide
Okay,
today.
so this is
We'll also
Natalie.
be meeting a
She's going to
patient
be,
today,
sometimes it's
George,
Diana,
who is going to
sometimes
help
it's,
us get you up to
whoever it's going to
speed.
be.
Let's get started.
Your intro, they'll tell you the scenario, they'll tell you the
Hi there,
situation,
I'm
and
George.
they'll introduce
Pleased
you
to meet
to the
you.
patient. So
Before we
just real
get too
quick,
focused on our patient today, let's get you familiar with our room and how to navigate about.
this scenario
Start
will
by taking a look around.
help you look
You have a
around.
360-degree view,
You
and
can
there's a
turn
lot to
around
take
all the
in. If
way.
you're joining us in a headset, don't forget to move your feet when you turn to keep yourself balanced. If you're joining us on screen, you can look around by using your mouse. You won't be able to interact with much yet. We'll come to that soon. Now, let's try moving around the room as well.
Okay.
Try taking a step closer to George and back
She's talking
again.
a lot.
If you're joining us
Okay,
on
so
screen,
in this scenario, you can go up,
arrow keys.
down, like
Next,
your
let's
height,
get you up to
you can
speed
move it
with
up
how
and
to
down,
interact with your
and
environment.
then you can
may have
turn
noticed a
side to
small
side.
white dot
This
in the
is the
center of your
clock
view. That's your
up here.
cursor. If you're joining us in a
You,
headset, simply move your
I'm
head
gonna
to
mute
move
her.
the
Hold on a
cursor.
second. I don't know if you can hear me or not.
Moving your headset's controllers.
She
You'll be
talks
able
a
to
lot.
tell
Anyway,
which items you
so
can interact
this
with
scenario will
because
help
they will
you
glow
get through a
blue.
lot of
To
the
select an item,
introductory
use
things.
the A button or the trigger on your hand controller to click. If you are joining us on the screen, you can do all of this using your mouse. Let's give this a go and try washing our hands. Take a look around and find the sink. Move your cursor to the sink, then click to wash your hands.
Okay. So I'm not going to wash my hands just yet. So I'm going to take you around the room really quick. This is obviously our crash cart. If you turn all the way to the right, you're going to see leave scenario. Don't click on that unless you actually want to leave the scenario because you can't get back in after you click on it. So crash cart, this monitor above you will turn on when you are doing vitals. And in order to do vitals, you're going to click on these little doohickeys over here. That's the blood pressure cuff,
The sink is on the wall just to the
blood
left of the
glucose
desk.
monitor,
Remember, if you're
thermometer,
using the
O2
headset
sensor,
to
and then
control
these
the
down
cursor,
here
you need
are
to
going to
look
be
at
your
the sink
labs.
and then click to wash your hands.
I hope she's
If
not louder
laser
than me.
pointers are enabled, you will be able to point at the sink using the controllers.
Okay, then turn all the way around. You can see you have your computer, your med cabinet, your oxygen is on the wall. Keep an eye on your time because you will get kicked out of the scenario if your time expires. The phone is important as well to call the provider and give an SBAR. And then you always want to make sure that you wash your hands first. And all you need to do is click on
Great.
the
You're
sink.
getting the hang of this already. Now that you've washed your hands, let's try talking to George. Move your cursor to George's head, then click to see the questions you can ask him. There are a lot of different options, but for now, let's stick with the basics. Let's try asking him about why he has come to the emergency room today. You can do this by clicking on Presenting Complaint and then selecting Presenting Complaint in the submenu.
Okay, so communication, there's communication, and then a little later on, which you will see is examination. So if you click on the head, it will open up all of these different options. So you go through and you click on general, and then you can verify the patient's name and date of birth. Okay, so side note, the name and date of birth of the patient will be where it is, where you see it now. But initially, you will have to go through and verify the patient by name and date of birth. Yes, absolutely. There are some scenarios, though, where it disappears. So if that happens, if you've already clicked on it that initial time and then it disappears, don't freak out. I have been told that during the scenarios, if that does happen, you've already verified the date and birth, the name and date of birth of the patient, so you don't need to do it again. In this scenario, you do. In this scenario, you will go back and go through and say, like for the 5 rights of medication, for example, which she will go over in a moment, you will have to go back through and verify the name, date of birth of the patient, verify the allergies, and then go through the other things. So yeah, so some scenarios it will disappear, some it will not. So keep an eye on that. So you want to verify the name and date of birth.
Before I ask you anything more, can you confirm your name, age,
And you
date
can
of birth?
stack the questions.
My name is George Hamilton. You can call me George. I
And
was
you can
born on April
ask
16th,
the patient,
and
how are
I'm
you
28
feeling?
years old.
We can come back to that later. For now, let's ask
Okay.
George about his presenting.
So we're
complaint.
verifying. So then you'll go back to communication and then presenting complaint. And then you would go presenting complaint. And then you can also go back and do history of presenting complaint, ask about pain. You can do all of those questions. And in a normal scenario, you can stack the questions. And what I mean by stack is you don't wait until the speaker, which is technically you, is done speaking. You go back and you add on as many questions as it will allow. And then you can do other things while it's asking the questions, but make sure you're paying attention to the answers.
Can you tell me about what's brought you in today?
I don't feel too bad today, to be honest. Just a bit of a runny nose and sore throat.
Good work. You'll have time later to come back and explore George's symptoms some more. For now, let's move on to the examination. We'll start by listening to George's chest.
Okay.
To do this, click on George's body.
So,
and select
like I said, up
respiratory
above is
exams,
communication.
and then
You can ask him all the
lung sounds to
questions
listen to George's
listed.
lungs.
And then down below is examination. So you click on examination and we're going to be listening to George's chest. So cardiovascular. And then we're going to do auscultate heart sounds. And then I can't remember what she said.
George's lungs. You can do this
Oh,
by moving your
lungs.
cursor onto
Oh, she
George's
wanted us
chest
to do
and
lungs.
clicking
I
to
wasn't
select
paying
the
attention.
respiratory exams menu, then selecting the desired exam.
Okay.
We can come back to that later. For
Okay.
now, let's listen to George's chest.
That's what I was doing. So respiratory exams, we're listening to lung sounds. So there we go. So click on auscultate lung sounds and then look, your little stethoscope will show up. It'll do all the work for you, but you do need to listen to the sounds because it may ask you later what you heard. Or you'll have to give an answer in the SBAR as far as what you heard.
Right. Let's get some vitals for George. You'll notice on the cart beside you that there is a selection of equipment for you to use. Let's start by checking his saturations and heart rate. To do this,
Okay, so you
just
click on that.
the SATS probe. The readings will appear on the monitor above my head.
And then you can see it up here.
Great. You'll notice that
So
the
his heart
value
rate
on
is
the monitor will
86.
change
His
over
saturation
time.
is
If your
95%.
patient is getting sicker, you will see their vitals get worse. If you manage them correctly, you'll see their numbers improve. You'll have time to get a full set of vitals later. For now, though, let's move on to investigating our patient. There are a whole range of investigations you can do, including labs, EKGs, and radiology. Many of these are part of a standing order set already in place for you to utilize. Standing orders are available on the computer to expedite care for patients. Take a look at these to see what can be done without having to call the team to obtain orders. I'll go through where you can find each item. How about we look at the computer and see what those standing orders delegate to us?
Okay.
Then click on me, select cardiac tests and monitoring, and
So you're
then
going to look
choose
at the
Ask
computer.
for EKG.
It says standing order set. So you click on the computer and it will populate the standing orders. Sometimes it will, if it doesn't say standing order set, sometimes it'll just say computer and it will give you options of things you can look at in the computer, like the patient's chart or medications or anything like that. So, or guidelines and things like that. So we're looking at the general oxygen, COPD, IV access, ABGs, job, blood, and EKG, all those parameters that we need to keep an eye on. So this is good information to keep in mind as well. So anytime you want to look at standing orders, then you can check the computer for those. And you can just click off of it to make it go away. and then go back, like she said, and click on her. And you can ask her to perform some of the testing. So for example, blood tests, you can ask her to get an ABG or blood glucose. Let's just do that
Please come
since
back to that
ABG is not an
later.
option.
For now, let's get an EKG.
Oh,
Just
she
click
wants us
on
to get an
Me and
EKG. So
select
we're going to do cardiac
tests and
tests
monitoring.
and then ask for EKG.
The EKG is done. I'd like
And
it
then
on
it
the
will
desk.
be on the desk. And you can
review the
click on
results
it
by clicking on the EKG.
and you can take a look
To
at
close
it.
the EKG, just click on it again. Let's try this now. Great work. Let me tell you a little more about the bedside tests you can do and how to get your results. Most of the tests you will need are available.
I
in
wish I
both the
could fast
bedside
forward
test
through this
menu,
because
which
there's
you'll
20
find
minutes
in
and
the
I don't want it.
boxes on
It's
the
like
bottom
25
shelf
or
of the
30
bedside
minutes long and I
cart,
don't want to be on
or
here
by
for that
clicking
whole
on
time.
Me. You'll notice that some
So
tests and procedures you'll have to do yourself as they're beyond my scope of practice. But some tests I can do for you. When the
anyway,
test
this
has
is a
been
great
done,
scenario
I'll let you know when
to
the results are back
familiarize
and where to
yourself with
find them.
all of the
Let's
things
try
in the
another test.
room.
How about
Like
we
I
get a
said,
urine
these
dip?
over here
You can
are
find this
your
option in the
blood
bedside
pressure
test menu
cuff,
on the
your blood
bottom of the
glucose,
bedside
your
cart.
temperature, your
Click on it
oxygen.
and
Down
select
here are going to be
urinary
your
tests and
bedside
monitoring.
testing.
You'll find the
So you
option
can
for a
do
urine
your
dip and
cardiac
culture in
tests,
there.
your respiratory tests, your urine tests, blood test, and IV access is a big one. I clicked on it, but it's not letting me do it. So and it'll just be, you'll click on it and then it will list what's available to do in this scenario. And you can
Don't
go
forget
back.
about that urine dip. You'll find the
So she
bedside
wants us
test
to do a
menu
urine dip.
on
So
the
I'll just
bottom
go
shelf
to
of the
urinary
bedside cart.
testing
Just
and
click on the
monitoring.
boxes
And then I'm
select
going to ask
urinary tests and
for
monitoring.
take a
We
urine
can come
dip.
back to that
Sometimes it will
later.
say
For now,
ask for a
let's get a
urine
urine
dip
dip.
or take
Just
it
click on the
yourself,
bedside test menu
depending on
the
the
bottom
scenario.
shelf of
So
the
in this
cart
case,
next
I'm
to
going
the
to say
bed.
take urine dip and
Don't forget
culture.
about that urine dip. You'll find the bedside test menu on the bottom shelf of the bedside cart.
So there's
Just
lots
click
of
on the
different options
boxes
here.
and select urinary tests and monitoring.
Anyway,
The urine dip is done. All clear.
go back.
You can see the results on the
Close.
computer.
Okay,
It's
and
over on
then the
desk.
results
Let's
for
review them now.
labs and
You
things
can
like
find
that
them in the
are
results
going to be on the
menu.
computer. It still says standing order set. There we go. Now it says computer. And now we have different options. So we can document the vitals. We can look at the results, the urine results.
Great. Those results look fine.
They're all
While we're on
good
the computer,
within
let me
normal
tell you
limits.
more
So
about
then you
what
click
else you
out
can
of
find
it.
on there. On the computer, you'll be able to access lab, urine, and radiology results. However, the computer has plenty more to help you. You'll be able to view online medical records for your patient, as well as view any charts.
Sorry,
like
this is
medication
kind of boring.
orders, fluid balance, or skin assessment. There are also protocols and guidelines,
Yeah.
which you might find helpful if you need a reminder about
So
how to assess
radiology
and manage a
results, you
particular
want to
condition.
document
Finally, you'll find the early warning score calculator.
this
Once you've taken all your
is what she's
vitals,
talking
you
about
can
right now.
document them on the computer, and it
So
will
this is where
calculate
you're
a
going to
score
go
for
to
you.
document your
You
vitals. So
can
you
find
would
out
look
how
up
to
here.
interpret this
Right
score in
now,
the
his heart
guidelines
rate
and
is
protocol
90
section.
and
For now,
his
though, let's
SpO2
move
is
on.
95. So you can document that.
Next, I'm going
Heart
to tell
rate
you how to call for help and advice if you need it.
is
Let's try
90.
calling our attending. Click on the phone on the wall
Okay,
next
she
to the
wants us
sink
to.
and select Deliver SBAR Handover to Attending.
Okay, so
You'll be
she's
asked
asking us to go
complete
through
your
just through the
handover with a
motions.
series of multiple choice questions.
So we're going to
Just
click on
select
the
your
phone
answers.
and click
Sometimes
on
you
deliver
might be asked
SBAR.
with more than one option. Once you've completed those, the attending will then give you their advice and any management they think necessary. Let's try this now. Click on the phone and call the attending.
At this point in time, you're going to be calling the attending to give your SBAR. It's going to go through several different questions in order for you to give that SBAR. The first question is going to be about the scenario, right? The situation, what's going on. So you'll click all the things that are pertaining to this scenario. The next question is going to be about the background, what's going on with this patient. Usually it's one or two things. And then the third question is going to be the assessment. What are the indications that you're seeing in this patient? And then lastly, you're giving your recommendation. So it'll go through all of those questions. And then each one does count. So in your scenario, this particular scenario is an introductory scenario, so it doesn't necessarily count in this one. But in future scenarios that you perform with OMS, it will definitely count. So you want to make sure you're paying attention to the answers. So when you ask your patient questions, take note, because that will count in your SBAR. So you don't want to get those answers wrong. Like I said, you're able to do this scenario over and over again. So you will be able to correct it if you are incorrect on the questions and answer part. But this will give your attending your information. And then after that, the attending will either agree with you or disagree with you. And then we will go from there.
I'll put an order for some acetaminophen on the computer for you, and I'll
So
come and review
I
George
got that
later.
question wrong.
If you need more advice, you can call me back.
And that
you
will
can
dock
also
your
call your
points.
charge nurse
So
for
make
extra
sure you're
help, too.
listening to the results
Good
and the
work.
information so you can
find that
get
order
that
on the
right.
medication administration record on the computer.
Okay,
The
so now she wants us to go
acetaminophen
back to
is
the
in drugs
computer.
cupboard just above the desk. All the medication is listed alphabetically, so it's easy to
Why
find.
won't it let me go
First,
out of
we
that?
need to perform the 5 rights of medication administration. Click on Verify Name and Date of Birth. George will verbally tell you, as well as show you on his wristband. You can also check any medication by clicking on the cupboard and the medication you plan to give. At the same time, click on the Medication Administration Record or Fluid Administration Record to verify right drug, right dose, right route, and right time before giving George his medication.
So pay attention to that particular information, because how you do it, the order you do it does matter. So you can't just go to George, ask him his name, go back to the MAR, look at the MAR, go back to George, ask allergies, go back to the MAR. Like, you have to do it in the right order. Otherwise, it will not count that you did it. So even though you may cover all of the things, you have to do it in the correct order in order for it to populate that you completed the 5 rights of medication. And that is one thing that has been a thorn in many people's sides. So please keep an eye on that one. If you need to do this scenario in particular more than once, you are welcome to do that. So I'm not gonna go through the entire, I have like 12 minutes left. So anyway, so just go through this scenario. This is the scenario, what it looks like. Familiarize yourself with it, the phone, the code button, because in some scenarios you will have to hit the code button. All of the different things that populate, check those out. Medications, you can look at the medication administration records. So now, like, the doctor ordered acetaminophen. So here's acetaminophen. I want to look at 1 gram. So I'm going to go through, it's alphabetical. So I'm clicking on A, acetaminophen, 1 gram, and it says orally. So orally, and it's going to ask me, are you sure? I'm going to say no, because I wasn't listening. So I didn't complete my 5 rights of medication because I didn't ask him his name, his allergies, and then look at the MAR, and then, you know, all of the things that she was saying. So pay attention to that, because otherwise you will get that one wrong, and it will count against you. So anywho, I'm going to leave this scenario.
Verify name and date of birth. George will verbally tell you, as well as show you his wristband. You can also check any medication
she has to stop
by
talking
clicking
for
on
me
the
to get out of
cupboard
it.
and the medication you plan to give. At the same time, click on the
Okay.
medication administration record or fluid administration record to verify the right drug, right dose, right route, and right time before giving George his medication.
Yes. Yes, we know. All right, so then after your scenario is complete via either you were kicked out because your time ran out, or you've completed all of the tasks that you needed to do, either by finishing what she's asking you to do, or because she won't be there reminding you in every scenario, you will have to figure it out kind of on your own. So this scenario is kind of the introduction to it. In further scenarios, you will have to just kind of have a flow and understanding of what you need to do in this scenario, what the focus is. Oftentimes it will be a focused assessment. So you're going to want to focus on those things. You don't have to do all of the questions listed. Like if it's a cardiac focus, you're not going to ask questions about, I don't know, your genitals or your gastrointestinal necessarily, you know what I mean? So make sure that what you're looking for is focused on that, that assessment. Okay. And then it will go through, after you're done, it will go through, excuse me, a guided reflection, and you'll be asked a couple different questions, like, how did that go? Come on. How did that feel? Talk about 3 things that went well and why did they go well? You don't have to stay on here and actually talk through it. But if you want to think about it for a second, you can. Why won't it let me get past it? Shoot, there we go. What specific actions can you take to improve your future practice? And then thank you. That is the end of your guided reflection. Okay. Beyond that, I'm going to go ahead and share my screen again for my desktop this time. And we're going to go back to the OMS scenario. In this one, it will show you kind of your scenario, how you did, maybe some things that you missed or things that you need to work on. It's just going to go through and say, hey, you did this great. This is awesome. Hopefully you have a lot more check marks. But it's just going to go through. I got 100% because yay, I went through it. On this one, but typically you will have many checkoffs that you will have to do. So like asking the patients all the necessary questions, going through the history, going through each body system that's pertinent to the patient's situation. So just keep those things in mind for future assignments. All right. Another thing to keep in mind is session history is up here. So you don't have to go through this scenario to end up at this point. Once you've completed a scenario, you can go to session history, and then you can see all of the things that you've done. All the times that I've failed and have retaken the scenarios to get a better score. I've failed miserably at certain times, but the good thing about OMS is that you can complete the scenario as many times as you need to before the due date. And the highest score, or the last score or the highest score, don't quote me on that, I would have to figure that one out, is what will transfer over. But you do need to make sure that if you start the scenario over, you have to X out of this screen, go back to your initial screen and get a new code, or go into the scenario again in order for it to transfer over. If you don't, it will not transfer over, and you will need to take a screenshot of your score and the scenario for your professor and email it to them. So that is pretty much it. I hope that was helpful. It was very boring and I apologize for that, but I hope it was helpful. If it was helpful, that's great. If you have any questions or concerns, or if you're confused, please let me know. I'd be happy to help you through it. Like I said, there are tutorials. Excuse me, I have a frog in my throat. There is a tutorial in the, I believe it's in the ELO on OMS, that will help you set up your VR goggles. So keep an eye on that, or it may be in the announcement somewhere in your course. So keep an eye out for that. Go through it. If this is your first semester with OMS, it's a treasure, let me tell you. There will definitely be some scenarios that you're like, what the heck? I can't get past this one point. Reach out, reach out and ask people that have gone before you and ask for advice, because there are tips and tricks. Like I said, stack those questions. You can also stack your procedures and your examinations. You do not have to wait for them to be completed necessarily. So things like that will help you get through those tough times. Anyway, that's it for me, y'all. You have a wonderful day and flame forward.